Hi, my name is Heidi Galarza Argudo, and today's topic is intensive diabetes therapy and glomerular filtration rate in type 1 diabetes. First of all, I want to explain to you the definition of an impairment glomerular filtration rate, which is a final common pathway of diabetic kidney disease.
Sometimes kidney symptoms are pretty obvious, but there are also times when kidney symptoms don't appear until years after a kidney problem has already been in progress. Hi, my name is George McKenzie. I started having kidney symptoms when I was just 12 years old. At the time, nobody thought I was old enough to have pain in my lower back from a kidney problem. It was diagnosed as a pulled muscle, but it kept coming back for about 10 years. And finally, at age 22, I had a full-blown kidney stone attack, and the stone had to be removed surgically. I was in the hospital for about 5 days. I've had about a dozen kidney stones since then. Some I didn't even know I had. Others have been extremely painful. Now, interestingly, over the years, I've noticed that kidney problems seem to run in families. My mother and brother have both had kidney stones. My cousins have had kidney stones. So when you talk about kidney symptoms, I'm pretty clued in. But that said, I've had the script for this video reviewed for accuracy and approved for publication by a medical doctor. And you should always seek professional medical advice if you start experiencing some of the kidney symptoms like the ones I'm going to tell you about. This is a rotating diagram that shows you where your kidneys are located in your body. So you won't really be surprised to learn that lower back pain is usually the most obvious tip-off that something is wrong with your kidneys. But there are some other symptoms that are typical of kidney disorders too, including anemia, chills and fever, decreased cognitive functioning, elevated or lowered blood pressure depending on the condition, elevated heart rate, low energy and sleepiness, muscle weakness, nausea, pale skin tone, reduced appetite, night sweats, swelling and inflammation in various areas of the body, unexplained weight loss, and vomiting. Now, there are also some kidney symptoms that are very similar to symptoms of a bladder infection. That's one of the main reasons you should talk to a doctor and maybe have some tests run. Kidney and bladder infection symptoms could include the following: a stinging sensation or other discomfort during urination, urine that looks dark and cloudy or even tinged with blood, a feeling you need to urinate even though little or no urine flows out. Kidney problem symptoms should not be ignored. Once again, if you encounter any or several of the symptoms of kidney problems I've mentioned, get medical help as soon as you can. The information in this video is a summary gathered from reliable websites and other reference works, and once again, I had an MD review the script before editing, but one particular resource has been especially helpful, and you should take a look at it if you need more in-depth information than I can provide in a relatively short video. It's a book called The Kidney Disease Solution, and it will be really helpful to anyone who's concerned about their own kidney health or the health of a loved one. Besides going into greater detail on some of the topics I've talked about, it contains a lot of information about the role played by such things as diet and stress. Learn more about the Kidney Disease Solution by clicking on the link below this video. I highly recommend it.
So, application in medicine. Once the glomerular filtration rate is impaired, cardiovascular disease events and progression to end-stage renal disease occur at unacceptably high rates even with proven medical management. This video explains us the end-stage renal disease.
End-stage renal disease afflicts 1.5 to 2 million people worldwide. When dialysis is available, it can be life-sustaining, but this short-term solution is time-consuming, expensive, and does not replace all of the functions of a healthy kidney. Meanwhile, a global shortage of donors means that hundreds of thousands of people die each year waiting for a kidney transplant. Scientists at UCSF are leading a research project with partners nationwide to help these patients. They're working to develop a small, implantable device that replicates many natural functions of the kidneys. Super efficient membranes, created using silicon nanotechnology, will filter toxins from the blood without requiring pumps or electrical power. While a bioreactor containing specially engineered kidney tubule cells will perform other renal activities, maintaining appropriate water volume in the blood, electrolyte balance, and metabolic functions. These two advanced technologies will make up a small biocompatible device that attaches to the circulatory system and removes toxins to the bladder as waste. The artificial kidney will allow patients to live untethered from dialysis machines, eat and drink more normally, and live their lives more freely. Completion of this ambitious project will profoundly improve the quality and length of life for patients with kidney failure, as well as reduce the cost and personal toll of this devastating disease.
So this underscores the need for primary prevention of impaired glomerular filtration rate in persons with diabetes. So in this case, the primary prevention is the intensive diabetes therapy. Which are the benefits of long-term intensive therapy? It promotes near normal blood glucose levels. It also reduces risk of developing severe eye disease, impaired kidney function, heart disease, and stroke. But let's be a little bit specific. The intensive therapy has shown 50% lower risk for developing impaired kidney function. So this is big. It also reduced heart disease and stroke by almost 60%. And finally it reduced the severe stages of diabetic eye disease and need for surgery and procedures by 50%.
Reporting from the American Diabetes Association's 73rd Scientific Sessions, the largest diabetes meeting in the world. I'm Anna Baker with breaking news from McCormick Place in Chicago. Today we heard good news about long-term intensive therapy for people with type 1 diabetes. That describes patients who manage their diabetes with frequent insulin injections or insulin pumps, guided by frequent self-testing. Not only does this treatment help them achieve near normal blood glucose levels, it also substantially reduces their risk of developing severe eye disease, impaired kidney function, heart disease, and stroke. These findings are the latest results from a landmark government-funded study that just hit its 30th anniversary. In 1993, this NIH-funded trial first reported that keeping patients' blood glucose levels near normal reduced the early stages of eye, kidney, and nerve complications by as much as 76%, compared with conventional therapy. While the initial results were dramatic, we didn't know whether intensive therapy would also reduce complications longer term. So follow-up has been conducted over the past 20 years to figure that out, and the new data continue to show positive results. Let's go over this in more detail. Kidney disease. Long-term intensive therapy has shown a 50% lower risk for developing impaired kidney function. This is big, since kidney failure increases the later risk of heart disease and death more than any other diabetes complication. Heart disease and stroke. Cardiovascular disease is a major cause of early death from diabetes. Investigators reported that intensive therapy reduced heart disease and stroke by almost 60%, which should over time lead to fewer early deaths. Eye disease. Diabetes is the leading cause of blindness in adults. Intensive therapy reduced the severe stages of diabetic eye disease and the need for surgeries and procedures by 50%. Although we have means of treating severe eye disease to prevent vision loss, it is always better to reduce its development in the first place. And there's more. 2/3 of study participants experienced gradual stiffening of their hands and shoulders. Keeping blood glucose levels near normal will also lower the risk of this common complication, which affects your ability to carry out daily activities. So what does this mean for people with type 1 diabetes and their diabetes care providers? It's important to start intensive therapy as soon as possible and stick to it over your lifetime. Yes, it comes with more effort, more expense, and increased risk for hypoglycemia or low blood glucose. But that pays off in the long run because it considerably reduces your risk of developing serious complications. Now we need to make sure that all patients with type 1 diabetes are able to take advantage of these remarkable findings and to make intensive therapy as convenient and as safe as possible. I'm Anna Baker with your breaking news update from the American Diabetes Association's scientific sessions in Chicago. To view this press release online, please visit the For Media section of our website, diabetes.org. And for the latest video coverage of the meeting, stay tuned to diabetes.org/breakingnews.
On the other hand, death occurring before impairment of the glomerular filtration rate is a potential competing risk with intensive therapy. Disease. In type 1 diabetes, the body does not produce insulin, which is a hormone needed to convert sugar, starches, and other food into energy needed for daily life.
Type 1 diabetes is a condition in which the pancreas produces little or no insulin. Insulin is a hormone that helps your body use blood sugar, known as glucose, for energy. Your body takes the food you eat and breaks down fat, protein, and carbohydrates for energy. While your body is digesting the food, the carbohydrates are broken down into glucose. The glucose is then absorbed into the bloodstream, where it is carried to cells throughout your body. Insulin helps your cells absorb the glucose in your blood, allowing it to be used as energy. A healthy pancreas releases a regular supply of insulin into your bloodstream. After you eat, your blood glucose levels rise, and your pancreas responds by releasing more insulin to move the glucose into your cells. Insulin acts as a key, opening up the cell so it can accept the glucose. In a person with type 1 diabetes, the pancreas produces little or no insulin. Without insulin, blood glucose levels rise. Without insulin, glucose cannot enter the cells and be used for energy. As a result, it remains in the bloodstream. As a person with type 1 diabetes, it is important to monitor and maintain healthy blood glucose levels. High blood glucose levels over a long period of time can lead to health complications. If your blood glucose level drops too low, even for a short amount of time, you may feel dizzy or too hot or cold. If your blood glucose level drops extremely low, you may lose consciousness. By taking insulin as prescribed by your doctor and maintaining a healthy diet, you can keep your blood glucose levels within a healthy range.
Common symptoms are urinating often, feeling very thirsty, feeling very hungry, extreme fatigue, blurry vision, cuts, bruises that are slow to heal, weight loss, even though you're eating more. So this is a testimony of a teenager with the common symptoms.
Hi, I'm going to be talking about symptoms for type 1 diabetes. Some of the symptoms are losing weight, dehydration, frequent urination, blurred vision, fatigue, and I had all these symptoms, and I don't know how much weight I lost, but I lost a few pounds, which I knew it didn't make any sense because I was eating a lot of food, like lots of sweet food, which should make you fat, but it was doing the opposite for me. I would make cookies and brownies and just junk food every day, and just like eat it all, maybe eat all of it or almost all of it all the time. And I thought it was awesome because, I'm like, oh, I'm losing weight and I'm eating all these cookies, but obviously there was something wrong with me. I was always very thirsty. I drank water and orange juice and Gatorade, drinks like those all the time. Like if there was just a glass of water sitting there and I didn't know whose it was, I just drink it because I was just so thirsty all the time, and I drink orange juice constantly. I also went to the bathroom a lot, like maybe 3 or 4 times an hour. Going on road trips was a big pain in the butt. Like we would just have to stop all the time, and sometimes my brothers and sisters would get a little frustrated and impatient with me, but I couldn't help it, obviously. I felt fatigue. I was always very tired. I took long naps quite frequently, and I also have blurred vision, but I didn't know I did until I took an eye test like a day after I was diagnosed. And I totally have blurry vision, so my parents wouldn't let me drive for a couple of weeks. But yeah, those are all the symptoms I had. But now I'm great. Obviously, I control my blood sugar, so I'm not going to the bathroom 3 or 4 times an hour. So I'm all good. Gained my weight back and a little extra, but that's okay. Alright, bye.
Treatment: insulin therapy, monitoring blood sugar levels several times a day, eating healthy diet that's with carbohydrate throughout the day, exercise, regular medical checkups, no smoking, no drinking alcohol. So other results of the study were the lowered glycated hemoglobin levels reduced the risk of microalbuminuria among persons with type 1 diabetes. The prevention of albuminuria is therefore a cornerstone of recommendations that encourage fight glycemic control in patients with type 1 diabetes.
Recently, we have discovered that diabetic patients, long before they develop overt manifestations of kidney disease, excrete very small amounts of albumin in the urine. And we refer to this as microalbuminuria. And we have developed specific tests that will allow us to pick up these very small amounts of microalbuminuria. And all diabetic patients, when they're initially diagnosed as being diabetic, should have a microalbumin test to look for this small amount of protein in the urine. And then we annually check, every year, we check for the presence of microalbumin, because that is the first clue that there is being damage done to the kidney in a patient with diabetes.
Thank you very much for your attention.